pain because I was convinced at that time that conservatively, 80% of the people who were being operated for back pain never should have been. They did not have a truly ruptured disc. And I gave a paper at the American Academy of Family Practice in 1972, which I entitled Back Pain, a Vast Clinical Wasteland.
Wow.
Because I had reviewed 250 patients who had had unsuccessful back operation, and when I really looked at their original notes, clearly they had never had a ruptured disc, and people were operating just because they didn't know what else to do.
Wow.
And unfortunately, medicine has gone down a dark trail for a long time. In fact, of course, in the Journal of the American Medical Association in July 2000, the medical system was listed as the third leading cause of death. 225,000 people every year.
Wait a minute. Did I just hear you right? Did I just hear you right?
225,000.
Wow.
Third leading cause of death in the United States. Now, that was in 2000. And I suspect it's a lot more than that now. But nobody seems to be excited over that, except me. I mean, you know, we talk about people being killed by drugs, surgery, and hospitalization, and nobody's excited over it. Well, and of course, Paul Rosh, who is president of the American Stress Institute and a clinical professor at one of the New York universities, says it's 3 times that, so it would actually be the number 1 cause of death. And the reason he says that is people are often signed out as dying of a disease when actually they died because of a drug.
Wow.
And of course, chemotherapy is one of the big killers. Personally, you couldn't pay me $1 trillion. I used to say $1 billion, but that's no longer pertinent. $1 trillion to take a chemotherapy agent for anything. I think it kills far more people than it ever cures. It kills far more people than it cures. So basically, the important message is that people have to learn how to be healthy, stay healthy, and take care of themselves and ask questions, and don't do any major intervention until they've asked at least 3 independent people before they go have surgery.
Indeed. So let's get specific. What are some of the most important factors in health as you understand them?
Well, now, that one is easy. Number 1 is attitude. An attitude that I'm okay, I'm worth taking care of, and not smoking, keeping your body mass index between 18 and 24. And, of course, 2/3 of Americans don't achieve that. They are overweight.